Hello, friends. Welcome to this inaugural episode of Live Life More podcast. And we have with us a great personality, a torchbearer, I would say, of South Asian health, right here with us in this show. And I really thank him from the core of my heart for encouraging such an initiative where we can bring the topics related to South Asian health. We have with us none other than Dr. Arun Garg. Dr. Arun Garg, welcome to this talk show and thanks for sparing your valuable time for being a part of this initiative.
It's a pleasure. It's just wonderful to be with you, and thank you very much for having me. And if you will allow me to also say how much I appreciate the effort you're putting and the effort you have put in South Asian health. And hopefully, this is the beginning of the new year, and maybe we are making a commitment to people again in the new year. Let's all work together. So I'm very pleased to be with you and your listeners and viewers. And thank you again.
The honor is really something which I will keep it very dear to my heart forever that you encouraged me to start this. I have been doing this in India for many years, and I had produced roughly around 3,000 talk shows on radio and TV focused on health. But it has been a journey over here, and after I moved to Canada, I always had this desire in my heart to do something for our community for health awareness. And thank you very much, sir. And I'll take you to the first question which we would like to take up. I would like to, first introduce to our audience what makes Dr. Arun Garg what he is today. So, what is your personal story behind all
It's,
this journey which you have done?
that's a $64 million question, Sandeepji, as you know. Yeah, well, it's been a beautiful journey. It has been a long journey. Obviously, like all journeys, there were obstacles, there are challenges, but there are opportunities. So I was born in India. I left India at the tender age of 19 on my own um, to pursue higher studies in Canada. And, that was September 1965. Just imagine the time era. Canada was nowhere on the map and nobody went to Canada. But here I am from the tropics of India. I was born in Agra, hot climate. I hop on the plane without much thinking and all that which goes with it by myself. And here I am in Canada. And in Canada, I chose Saskatchewan, which is the coldest place on the
Wow.
earth. But that was the best thing I did because that exposure and that start in Canada made me what I am today, or what I have become. So my essence always have been to take the best of my heritage, which was India, Indian heritage, Sanskriti of Indus Valley Vedic civilization, 12,000 years, come to Canada and accept all the modernity and also what's good in Western European thinking. And I have lived that. So I would say right from day one, my journey has been taking the best of the East, which I brought with me, the best of the West, which was here, and tried to live that. And during this journey of now over 60 years, I was able to obtain a Doctor of Philosophy in Biochemistry from University of Saskatchewan, Doctor of Medicine from University of British Columbia, did 5 or 6 years of postgraduate work in biochemical medicine because that's what my passion always have been, biochemistry. So fellowship from Royal College, fellowship from American boards, all that professional work, and then was at Fraser Health as a permanent consultant starting in July 79, and I've stayed there. And during that journey, I was able to work and contribute in what I would say one of the biggest and the largest and most comprehensive integrated laboratory system, where we provide laboratory services to some 14 hospitals. And I was director of biochemistry there, medical biochemistry. Then I also provided administrative leadership as a regional medical director, and in the process was very fortunate with the support of my family, especially my wife, to participate in lots of community work, professional work, medical associations, and served their presidents. So a lot of leadership, but I never left India. In a way, I was here, but I always was with India. But when you're pursuing your professional career, you really don't have physical time to be in India. That opportunity came in 2003 when Premier of the province was interested in developing trade with India, and my friend Arvind Babbar, who was the chair of that committee, said, I will make a very good chair for India Market Advisory Committee. So from being doing my practice, I got exposed to a non-medical work of working with India. So that was my start of India, and we produce a very good report. And to make a long story short, during the journey of market advisory committee, beside developing trade and all that, the notion that people to people relationships are so critical. People to people relationship between Canada and India are so critical. And in a way, this was prophetic, because this is now 2007, 2008, and 2025. I would say there is the biggest need is for people to people connection between Canada and India. These are the two great nations, and we can do so much together because we share so many common values going back. India is some 12,000-year old civilization. Canada has people for 5,000 years. There's so much similarity in our values of celebration of diversity, equity, value in universality. Oh, these things are very deep among our people. We see it every day, and it's also quite deep in Canadians. So this has been, I'm sort of last 15 years, really have transformed from a medical practitioner to a community worker, community activist, and health has been my field, because in this journey I found that to my horror, I was not aware of through medical school that for whatever reason, I have better idea now, but for whatever reason, South Asians have 3 to 4 times higher preponderance of chronic diseases like
Hmm.
diabetes, hypertension,
Alarming.
renal disease. And I said, well, you can't just leave it. You have to do something about it. So that has been my journey now, and we will talk more about it, what we are doing and what we could do. I hope the listeners and the viewers will see this as an engagement. This is a commitment, and I know when you and I were talking earlier, uh, we both are making is we want to engage the community and people to to um, live better, live a healthier life, and we will certainly provide evidence and information to make that happen. And so I'm really delighted, and here I am after 1965 in 2025 now. So that's 35, 40, 60 years, solid
Yes.
60 years.
Phenomenal. A
uh,
phenomenal journey.
yeah, and it's going
It's an
strong.
era. It's an
Uh,
era you have already summarized in moments. 60 years you've summarized. Great. And I see that your passion for South Asian health is pretty much more than evident from your words. And you also highlighted that there are some challenges which South Asian population settled in Canada, in North America, has, especially the kind of genetics, genetic predisposition which we bring with us from that country. And in Ayurveda, there's a mention that when we were where we are born, our bodies are built, our bodies are made according to that zone or that environment, that climate. Whereas when we move, as you mentioned, from a humid and hot city of Agra to a completely opposite, climate, cold, extremely cold climate of Saskatchewan, the province in Canada. So the bodies have to adjust, and it takes a lot of toll on the internal system to adjust according to the food which we get and the climate which we are, having to face. So what made you bring these things, into Fraser Health, the particularly initiatives which are focused on South Asian Health Institute? Then you were talking about the collaboration and the network which you formed. I see that beautiful name, SINS, Canadian Indian Network Society. Well, we have been doing some sins in eating and drinking, you know, and those are sins, SINS, and you brought a wonderful creative name, Canadian Indian Network Society. So how can CINS, Canadian Indian Network Society, contribute in washing away the sins, that is SINS, which we do in our lifestyle and eating habits?
That's a wonderful analogy, and obviously you're very creative. If Sandeepji, if I could say, you must continue this work. We need people like you um, to bring people like me out so we can communicate. It's all about communication. It's all about storytelling, and it's all about making a difference. And for you to be able to take sins and had a parody, I think is phenomenal. Thank you very much. I will
Thank
use
you.
it. So I think to put it in a nutshell, when I recognized that there is a problem, and the problem is that uh, chronic diseases like diabetes, hypertension, coronary artery disease, atherosclerosis, renal disease, even dementia, even depression, all these chronic diseases are much more prevalent among so-called South Asian. South Asian is a very big word, and we don't have much understanding of many cultures, but uh, most of it I'm talking about is of Indian heritage, which is very huge because India was a much bigger geographically. And it's interesting how the gene pool has stayed very stable in that whole area, even though political maps have changed and different countries have created. So it's reasonable to use the word South Asian, and it's reasonable to say South Asian heritage, and it's reasonable to see people who have migrated from various from that core area of subcontinent to Fiji, to West Indies, to South Africa. The gene pool has remained very stable, so the problems are very similar. However, the genes and the gene pool only account for very small amount of the pathophysiology or pathobiology of these chronic diseases. Environmental factors, as Ayurveda clearly talks about, as yogic science clearly talks about it, plays a much bigger role. And I think, though we don't have time today, but if you will permit, I would love to talk about my interpretation of integrative thinking, integrative health, and fusion of the East and the West, and what pathobiology uh, in Vedic sciences, in yogic sciences, and how it's relevant in all this conversation. Because culture and culture in the broadest sense plays a huge role in in uh, uh, a manifestation of the diseases. And I
Mhm.
think if and because as humans we need to understand that culture to find the remedies. And I think so. I love to talk about this, and that's a topic in itself. For an hour or two, we can talk about, because there is so much on YouTube and there's so much material, but we need to extract out the wisdom of all this and then apply and practical. So, in my journey, when I found out that there is a problem, so what can we do? And I thought we have to be practical. We have to have a very outcome focus, and we need to institutionalize the solutions. The one thing I notice in our community, everybody wants to do much and many things, but they do it as individuals. There are very little um, establishment or very little um, relationship with the institutes. A part of it because we are still immigrants and our access to establishment is minimal, but I take the advantage of my upbringing here. But I believe that solutions can only be found if we institutionalize the solutions. So my effort have been in working with the institutes, and I was very fortunate to be working in a very progressive health authority called Fraser Health. Healthcare in Canada is organized in a very public sector, and Fraser Health, if we could use this opportunity to say, is one of the largest health um, uh, uh, administrative organization, serves
Mhm.
something like 1.9, close to 2 million people now. 33% of the population of the province is in this, and it's one of the most diverse group of people. And as it happens to be one of the largest in Canada, if not in the world,
Wow.
of South Asian group of people. We have people in the largest numbers. So just imagine, Sandeep ji, what an opportunity that provides to be able to influence such a large group in an organized way, because we have databases, we have opportunities, we have programs, and because Fraser Health, most of it is in acute care, but still there is an opportunity to do some work in chronic care and especially in the community care, and that's the focus I have taken in my journey in Fraser Health. And to do so, I approached the president and CEO of the day in 2011 2010, after we had organized the first CINS meeting on cardiovascular disease, that I think there is a need for a organized presence of South Asian health studies in Fraser Health. And I talked to him on the fifth floor on the elevator, as they say, elevator talk. By the time we were on the first floor, he said, "Done, go for
Wow.
it."
Wow.
And
Your
that was the
camera, your
uh,
camera, Dr. Arun, I think that needs, yeah, thank you very much.
I think that
That's,
just like the elevator, the camera also went down with
yeah,
it.
yeah, yeah.
But so that was a purpose uh, on 2 minutes. But to show you the challenge, that talk of 2 minutes has taken me 15 years to
Okay.
make it happen. So that means you have to be persistent, you have to preserve perseverance and a lot of prayers. So even when you
Yes.
have an idea, it doesn't mean it just happens. You have to work at it.
I can
Uh,
understand. I can well imagine. Even your camera understood the magnanimity
yeah, it
of
is
that,
really very satisfying to
Yeah.
see that this has taken the shape now. So we have a thing called the South Asian Health Institute, which is designed to bring cultural focus, cultural safety, cultural effectiveness, cultural efficiency to South Asian population in Fraser Health programs. So the institute, though it calls the institute, is a facilitator
Body.
and a brain trust within Fraser Health, to have Fraser Health become a leader in providing um, these services to South Asian people with that cultural lens. and now the programs are starting to run. We have three broad areas where institute works. One is the programs themselves, so cardiovascular program, emergency program, addiction program, mental health program. All those should have that lens. One of the dream I have is that Fraser Health will be the first health authority to start serving uh, nutritious, delicious, beautiful aroma, and great therapeutic value with spices Indian food to the patients rather than those
Wow.
frozen food. And we're working on it. Nothing is
Great,
so easy. It's a great challenge, but
great thought.
we'll get there. So that's South Asian Health Institute. South Asian Health Institute has three focuses. It works with the Fraser Health programs. It works with the community in engaging, in educating, and making them aware. So, like when the COVID came, we were able to reach out to people much easier. And then it has some global partnerships and some global ambitions. In
If you,
addition,
yeah, sorry. Yeah,
no,
please
sorry,
continue.
go ahead. Yeah,
Yeah.
in addition to that, when I was doing this report in 2006, it became very important that there is a need for people-to-people engagement. You can only do so much at the government level. You can only do so much in the bureaucracies. You need some nimble, flexible groups which can bring the passion and the personal ambitions and personal commitments to make things happen. What I'm talking about is a not-for-profit, community-based organizations which then provide network. And so we, rather than sitting, we said we'll create it and we open this Canada India Network Society. And so that's how Canada India Network Society came about. It's not a membership organization, but it's a project driven organization which brings people for project specifics. And we organize these meetings to bring people together. And then during the after between meetings, we take those projects and facilitate them. The work is done by the champions themselves because I felt that it makes sense that the people who have passion about a project should be leading the project. They should own the project, and we should just help them in some way achieving it. So that's what Canada India Network Society is. There is a lot of information on our website. People can reach that at www.cins.org. We organize major meeting every 4 years. Our next meeting is in June 26th. Hopefully, some of the listeners will be able to attend. So that's CINS. But in addition to that, I felt that there is a need for some administrative structure support through financing. So when I completed my 50 years, my wife and I made a major contribution to Royal Columbian Hospital Foundation, and we created a 50-year legacy fund, so 50-year legacy South Asian fund. And community under the leadership of Hema Bhatt has been supporting it. And our idea is to have this fund and in perpetuity, so then the monies from this fund then can be used to support some very good programs. So it's not a research fund, it's not a granting agency, it's not a fund to support capital programs of the hospital, but where the need is. And I feel the need is in the community. So there are many people who have some great ideas, but a small amount of money can go long ways for them. So idea is that have the fund and some of that could be used for that. We are hoping to raise something like $10 million, and then with that, interest of that can be used for that. We have already raised $2 million. Tremendous support in the community, tremendous support in the business leaders, and Hema Bhatt has been our champion on this. So Royal Columbian Hospital Foundation is where the funds are, and we will be having a inaugural lecture on March 2nd. Hopefully, you'll be able to come to that, and we will be announcing the fund. And it's at Taj Parks, and from 2 o'clock to 4 o'clock, and we have again, there will be three major areas the funds will be working. It will be supporting some very unique community based projects which might not get funding otherwise. It's not a research fund and it's not a granting agency, but we will be seeking out the projects which are already being done and see by providing further support to them, they could go to the next level. So it's still all the heavy lifting is done by the projects themselves, but the fund will support some. So it's a very unique way of supporting it. The second is it will organize 2 or 3 major public lectures for education and awareness with the community. So on March 2nd, we are delighted to have speakers from local lifestyle clinic, Dr. Brendan Byron, who is a leading light in lifestyle diseases. His colleague will be Werner. Dr. Werner will be talking about diabetes and how to overcome diabetes. Like as you know, type 2 diabetes now people say can be reversed. So
Yes.
long story short, that idea of lowering the burden of diseases in South Asian in chronic disease has led into 3 pieces of institutional establishment of outcomes: South Asian Health Institute, Canada India Network Society, and now 50-year legacy South Asian Health Fund. So it's
Great.
my hope that these three will continue as I go into wither away,
Uh,
and then that awareness of South Asian health will become much more effective, and dream will be that we lower the burden. And obviously, another topic one day we can talk about is diabetes. Diabetes mellitus is the key because of inflammation, chronic inflammation. The pathobiology is so much clearer now. And my own medical training and biochemical medical training and biochemical medicine at the cellular level is just so beautiful. And I feel so uh, blessed that able to look at Ayurvedic thinking of the 5 elements and able to look at what human is, the jiva, as we talk about the atma, the internal. And I think what it really amounts to is the external interventions and internal interventions. And I think internal interventions give you the self confidence, gives you self realization, and with that power of self realization, you are then able to make a behavior change and have a positive thinking, which then affects your health. And external interventions are required because, in spite of all this, you do get sick, and the sickness has to be corrected. And more fusion of the best of the research in quantum physics and the best of the research in industrial post-industrial medicine has to be used for this. So I think, as you can see, Sandeep ji, this has been a great effort to put together, and having now able to share with your listeners and audience what we have done. And added to this is the communications and storytelling. So
yeah.
I have been participating in writing editorials, op-eds, and appearing on shows like this. We have a show with Harpreet Singh. We have our own podcast where we're trying to reach. I've been writing op-eds in Drishti magazine. So this is in our own, but also on radio shows, because our community outreach is very important. And maybe we could raise that issue, which I raised with you, that in spite of these efforts, what is it that why we are not making a real difference yet? What is the dilemma? What are the barriers? And what can be done? And that could be another topic where we could engage people, because today's world, it's the engagement, empowerment, and education of the individuals. It's not just you and I talking about it. Everybody has to take part in it and say what the story is and what can they do.
Yeah.
Uh, uh,
Precisely.
yeah, so I think in summary, then we have summarized Houston, we have a problem, chronic diseases in the fifth space. South Asian population is much more diverse and has much higher prevalence of these diseases. So something has to be done, and ours is a small effort in that, and we are making progress, and we have come a long ways. Programs like these, but you're doing, and I think you bring so much to the party, Sandeep ji, because not only you have the show, not only you have this structure, but you are an artist and you are a singer, and those are healing, and there is a real importance in so it's not just the disease which you can just cure it, it's a healing process, and the belief systems and the music which healing process brings, and your music when you sing, the passion you bring, so this all has to come in it. So I'm really happy to be uh, working with you on this podcast to connect those dots.
Thank you. Thank you, sir, for the inspiration, and thanks for recognizing, appreciating what I bring over here. And what I summarize from our talk, from your elaborate, discussion which we just had, is that there is a policy change which is needed, which is you're already working on that through those all those things which the administration, the bureaucratic structure can be steered into a direction where the South Asian health concerns can be addressed properly. Then I would say engagement, either community engagement, so which you are already participating in. I would rather say that the young crowd, young generations, which are now more or less more westernized, from the you bring so much of India with you, and you the deep roots which you have. I bring India with me. We are passionate about our Sanskriti, our culture, our thought process. But what about the next generation, which is getting raised over here? You know, from very, very tender age, very small children who are, you know, getting raised over here. So the youth engagement. Then I would say technology and innovation, which we are, you, I, and so many other, people who are the, kind of stalwarts of communication over here. You have been on Nutan Thakur's show on Spice Radio. I know that. And then Harpreet Singh show. So all these are technology and innovations which we need to. I would rather. I had worked in India with an organization building an app on nutrition, nutrition journaling, food intake, so that our people know what kind of food they are taking in, the macronutrients, the micronutrients, what what a jalebi or a gulab jamun has, and what damage it can do to insulin resistance, in creating insulin resistance and reducing insulin sensitivity. uh, you know Portion control. Why, if we are being served two gulab jamuns, in a plate as a dessert, in a event where we have gone and participated a community event, why it is important that, okay, if you need a dessert, then the portion control is the key. It is not a sin to indulge in that indulgence, but it is a sin to overindulge in that indulgence. So a gulab jamun can be tasted, and the same thing, a piece of, just an edge of the iceberg, I would say. It is the iceberg. It is a big problem, the gulab jamun. But yes, if we just have the tip of the iceberg, a tip of gulab jamun, and keep it in our mouth for longer, we can relish that taste. But the caloric excursion, the glucose excursion, which our blood would have to handle by secreting more insulin, will be minimized. So it is about enjoying it, not letting the sugar enjoy our, you know, our body, rather than we enjoying the sugar only for a moment, and practicing moderation. So personal reflections and advice, a takeaway message, very short one from you, what would you say? The lessons learned in the past and the advice to the community and your vision for the future, and any inspirational message which you would like to
Yeah, thank
say.
you very much. And I think you brought out the area I was going to raise today, but we could do a whole podcast on nutrition. But I think if I could leave one word, that is 5 Ks. 5 Ks of eating. Eating nutrition is fundamental in good health, in lifestyle diseases. And कब खाते हो, क्यों खाते हो, कितना खाते हो, कैसे खाते हो, and kya khate ho are the 5 Ks which determines the food. And I think the important is kab khate ho. Just reading a paper this morning, clearly showing there is so much biochemical evidence now. There is so much physiological evidence for each one of these. You pointed out insulin resistance. You pointed out chronic inflammation. Those are the key sources for these chronic diseases, and a lot of it is lifestyle. So, my fellow listeners, viewers, what we are talking about is science, is evidence based, and
Absolutely.
it's embedded in the deep, deep civilizational understanding of Vedic philosophy of who we are. So I think you cannot go wrong if you could combine those two things. So कब खाते हो, क्यों खाते हो, कितना खाते हो, कैसे खाते हो, and then क्या खाते हो. And we could talk about the science of it. The last word will be, we have a problem, let's work together, we can overcome it, especially diabetes type 2. There is more and more evidence can be reversed if we all work with it. And certainly it can be prevented and it can be delayed. So, health promotion, illness prevention, and disease management are all three in your hand. Young people, middle age people, old people, we all in it together, and let's do it.
Thank you very much, Dr. Arun Garg. And you precisely use the same words which I studied in 19 from 1997 to 1999 for 2 years. My post graduation in preventative healthcare and promotive healthcare, preventive and promotive healthcare. So prevention of disease goes hand in hand with promotion of health. When you promote health, you prevent disease or manage disease better, and if you prevent disease, you are automatically promoting health. So you've already mentioned those two things, and that is something which I have been carrying as a passion for so many years. And had never imagined that I'll meet someone so wonderful who would resonate with what passion I have been carrying for so many years. And he will, in summary, he will summarize and bring those two words, in synergy the way they should be. So I'm so very honored and I feel fortunate that I met you in this lifetime. And that had to happen in Canada when I moved here. But I look forward to your encouragement, your support in future for me to be able to do what I had done in India for our community, and so that everyone is able to live life more. The slogan of my organization when I started it was to add years to life and add life to years. And that is so deep a meaning, which I have so close in my heart, that it is not about living long, it is about the quality of life in addition to the quantity of life. So we all take birth on this earth, but how we live our lives today will decide how long we are going to live and what quality of life we are going to lead. So, Live Life More is all about that. And thank you very much for being a part of this mission. Thank you very much for sparing your valuable time. And I hope that our listeners will see a lot of value in this talk, and they will help us spread the message. They will like the initiative, they will comment the initiative, and they'll also tell us what all topics they would like to they would like us to cover, so that we can bring what they want to learn about. And I'll request everyone to share uh, this podcast so that it can reach as many people as possible, and more people can benefit from this very enriching talk and thoughts which we had from Dr. Arun Garg. Dr. Arun Garg, thank you very much for sparing your time, and I'll see you in some other podcast with some new topic. But till then, stay blessed and live life more.
Thank you. Thank you very much. And remember to visit our website where a lot of information is available, and come and attend our inaugural lecture on March 2nd about 50-year legacy fund, where Dr. Warner will be talking about diabetes can be reversed.
Thank you very much, sir.
Thank
Thanks.
you.
Thank you.